Module 5.4, Clinical Details. In this session we're going to demonstrate how to add clinical details. We access clinical details through the medical record. At the top is a summary of the clinical details, among other things, is shown. We click the icon to open up the clinical details page. To start, the Family and Socials tab, we can enter things like marital status, which means single, divorced. We can enter in if the client has substance problems, drug use, is a smoker, alcohol, and the number or frequency that they partake per day. We can also add the occupation, which is coded. On the far side, we enter in the gender, birth gender that is, if different from current gender, sexual identity, and sexual orientation. In the lower section we can type in notes pertaining to family history and enter in diagnoses and relationships if their family is clients within the system. In this case we have a history of heart disease. We can add in diagnosis, past history of the client. We can add in allergies here, or adverse reactions, however you'd like to call them. In this case we enter in, again, it's the first few letters of the allergy. Then we select the allergy from the list of ICD codes, just as we would when creating a diagnosis. Again, we can enter in details, things like date of onset, age of onset, privacy attributes, severity, the status, but most importantly we must enter in the nature of the reaction, and we can change or add to this list as necessary. So we select one of these reaction shortcodes and click OK. Then we can click OK and the allergy will be created. Here we can enter in, if an initial visit for the client, we can enter in some measures: height, weight, blood pressure. Usually these will be entered in from within the encounter area, but for the initial visit we can enter it in here, and again we can enter in notes including diagnoses, procedures, adverse reactions. From the medication section we can enter in usual medications that they may have. Again, this all can be entered in from the encounter or from the medical record, but this is usually created during the client's first visit. And then we have immunizations and care plans. All of the information entered is now visible every time we open up the medical record in the status bar. So if we close the medical record and open it again, we can see that all of the information is available in the summary. So medications, notes, immunizations, care plans, past history, family history, social history, and so on. That's all we have from this section. I hope this helped, and we'll speak to you soon.